Hello everyone, I am Dr. Nikheel Pansare and today we are going to talk about coping strategies for chronic knee pain. Living with chronic knee pain can be challenging. But there are ways to manage discomfort and improve mobility. Let's start with lifestyle adjustments. Maintaining a healthy weight through proper diet and regular exercise can reduce strain on the affected knee and elevate pain. Low-impact exercises such as cycling and swimming can strengthen muscles around the knee joint and improve flexibility and strength. Stretching exercises targeted at muscles surrounding the knee can also help in relieving tension and reduce pain. In addition to physical activity, utilizing assistive devices like knee braces or canes can provide support and stability, especially during activities that aggravate knee pain. Knee braces and canes can help distribute weight more evenly and reduce strain on the affected knee. Finally, don't underestimate the power of pain management techniques. Heat and cold therapy as well as anti-inflammatory medication prescribed by your doctor can provide temporary relief from increased knee pain. Remember, chronic knee pain shouldn't prevent you from living a fulfilling life. By incorporating these coping strategies into your daily routine, you can better manage discomfort and improve your overall quality of life. Thank you for watching, and if you are struggling with chronic knee pain or any other orthopedic concerns, don't hesitate to reach out. Take care. I will see you soon.